As advocates in health, our ultimate vision is change. We mainly seek to change things outside ourselves, but somewhere along the way, we do change. This is my story of change with PANACeA. Staff of HAIN and a librarian by profession, I work with electronic information systems. Being involved with social health research for several years, I haven't experienced spending a long time with the community. From the start, I recognized that working with the PANACeA project would be a big challenge for me. But I was reassured by the support and guidance of our executive director, who has extensive experience working with communities. I felt ready to take the challenge. One of the PANACeA projects that HAIN is involved with concerns eHealth initiatives in primary health care. Along with Prashant, a doctor from Bangalore in South India, Dr. Shabina from Pakistan's Mardan district, and Dr. Sugi, a biomedical engineer from Indonesia. In the first PANACeA meeting in the Philippines, we jointly thought of this idea. Ahmad, our mentor from Aga Khan University in Pakistan, helped us refine it. I am fortunate enough to afford going to a private clinic or hospital for my healthcare needs. I took for granted that the barangay center provided services to those who could not afford private clinic consultations. I never really looked into them before. As I tried to understand the workflow in our partner health centers, I discovered that one of their main problems was data management. There was no consolidation of their day-to-day patient logbook, or at least until it was time to submit reports required by the Department of Health or other agency. The downside to the system was felt even more acutely when Typhoon Nandoy struck in the last quarter of 2009, wherein most of the town was flooded. The municipal health office had to save their data to be able to allocate the municipality's limited resources to target groups. Another concern of the health staff was the distance of some villages or barangays from the main health center, where more resources and services were available. I learned that often, a health worker from a far barangay would spend time and money for fare to take the trip down to the main center just to retrieve a laboratory result. These two issues can be addressed by eHealth tools, and this is what I am exploring with PANACeA. I have heard of these problems before, but it was a different thing seeing it firsthand. I meet my PANACeA colleagues Prashant, Sugi, and Shabina every year. They tell me similar stories of change in their places. While Prashant is setting up a web-based HMIS in PHCs in Karnataka, Shabina is trying to set up a referral system in the remote provinces of Pakistan where she works. Sugi is trying to set up an eHealth prescription system. They all followed a similar path of identifying gaps in primary health care and trying to address it through an eHealth solution. Working more closely with the community has helped me to learn to look at problems in health with a wider perspective. I have learned that it is not enough for a health researcher or advocate to simply seek change. We must also seek to learn from the community and let their lessons change us. I look forward to learning more from our partners in the community and continue on this journey of change.